How can young people be supported to exit homelessness permanently?
I think there's a lot of different um, kind of best practice solutions that we've seen. Uh, Housing first kind of platform, this idea of providing a safe sanctuary um, at first to kind of as the base offering, I think is really, really significant. Um, you can't figure out next steps if you don't have a stable place to live, right? Very, very basic and obvious. So there's different models, right? There's supportive housing, there's supported housing, there's independent living, there's co-op style living. So there's a lot of different housing options that I think are really, really key to provide a safety, returning home, if home is a safe space. I mean, there's a lot of work that we can be doing prior to people actually touching the street and falling into homelessness. Um, while once that housing stability has kind of been created, and a few of us, I'm sure you're going to be talking to some other researchers that are part of my team around, we looked at housing stability and kind of what happens after that with young people in Toronto and Halifax, and now we've actually expanded it to a few other cities. um, that study noted that housing is not the panacea, but it's an important foundational step, and then working with the young person kind of to look at what is actually needed here. What types of wraparound supports, what type of embedment in community, how do you create senses of belonging, how do you work on um, return to school or return to kind of the labor force in a meaningful, healthy way that will not overwhelm or strain individuals who are going through some trauma. So I think there's a lot of key ways that we can kind of build kind of circles of care, places of compassion that can really work to move people into civil society again, to get them kind of, back on a healthy path. Um, yeah, when we're dealing with addiction, mental health issues, time and time again, harm reduction elements have proven to be very successful with young people, more so than abstinence models. And so to infuse not only the philosophy of compassion and care and choice, but also the idea that none of us can change overnight. We need our time to reflect, to move slowly um, into levels of recovery. So that needs to be kind of, at the forefront of any type of intervention model. And there's a lot of different styles of modeling that have worked, like, dialectic behavior therapy, cognitive behavioral therapy, narrative work that has shown to have some promise with young people who are suffering through particular dynamics. So once you're housed, once you kind of can create a sense of belonging, you can kind of move forward. And we found in one of our studies that that one person that you're connected with that cares about you. I mean, for young people, it really should be their family, right? Their parents, but that's not always the case. So to have somebody who will hold your hand through a lot of the ups and downs of just normal adolescence, and add that the whole traumas of homelessness is a really key factor here.
That's really interesting. We're trying to highlight for students many of the foundational pieces of homelessness that are important to understand across sectors and fields, and that trauma informed lens is one piece of it, and that social inclusion is another. And I think that really can't be understated. The importance of feeling like you belong somewhere. It,
Right. It is so, that sense of inclusion and belonging is so, it's key to all of us. And and young people, they're still developing, right? They are in that emerging adulthood realm, and there's so much that's wrapped up in their identities around where they fit in civil society, and where they fit, and how they understand themselves. So that, like, those senses of belonging are so key.